Hello everyone, today we'll be talking about cancer radiation treatment. So a little bit of history about it. I'll start about a little over 100 years ago when the X-ray was first invented. So the X-ray was invented in 1895 by Wilhelm Conrad Röntgen. And in 1896, Emil Hermann Grube used this invention to treat a patient with breast cancer. So that same year, Antoine Henry Becquerel started to study the phenomenon of radioactive activity and the research of natural sources of radiation. And so then, 1898, Maria Slowska-Curie and her husband Pierre Curie discovered the radium as a source of radiations. And only 3 years later, Becquerel and Curie reported on the physiological effects of radium rays. And so then, through all these multiple studies, they found that radium and X-ray were actually able to treat some sort of cancers. So skin cancer was most frequently treated, as since it was on the skin, it required low penetration of tissue. So with the amount of energy that the X-ray was putting off, it was able to treat that rather than something else deeper. So in 1910s, X-rays were modified to emit higher energy using radium, which allowed the X-rays to treat deeper cancers a lot more through the skin cancer. In the 1950s, radiotherapy became recognized as a medical discipline, found in radiology in medicine. This is when a lot more research was coming out about it, and X-rays were starting to deliver a lot more energy, about 50 to 200 kVs. And so these new devices that were coming out, since they are delivering such higher doses of energies, it made possible treatments of deeper tumors a much greater possibility. And so radiology became about, and we started making a lot of headway into treating cancer. So the new millennium saw the creation of the stereotactic radiation therapy, leading to adaptive radiotherapy. And so that stands for ART, which is a special form of image-guided radiotherapy that consists of replanning and sometimes optimizing the treatment technique during the course of radiotherapy, which has proven to be a lot more effective than your standard X-ray. So how it works. So it's important to understand regular cell division before actually learning about cancer. And so, of course, in cells you have 5 stages that a cell goes through. And so in the cell cycle, the 5th stage, mitosis, is when the cell divides into 2 cells. So a normal cell will just divide, and that's kind of it, 1 to 2 cells. However, cancer cells grow and divide at a much, much faster rate, which is extremely dangerous. So what happens is these cells continue to multiply at a dangerous rate, and then these cancer cells inflate, and then these cells start attacking and destroying normal body tissue, which is obviously a pretty big problem. So radiation works by making small breaks in the DNA inside the cells. These breaks keep cancer cells from growing and dividing and causing them to die. Nearby normal cells could also be affected, but most recover and go back to working the way they should. Okay, and while chemotherapy and other treatments that are taken by mouth or injection usually expose the whole body to cancer, radiation therapy is usually a local treatment. This means it's usually aimed at and affects only the part of the body needing treatment. It's just radiation treatments are planned so that they damage cancer cells with as little harm as possible to nearby healthy cells. And so the whole purpose of this is to essentially halt the cancer cell from growing and dividing, which will ultimately lead to the death of the cancerous cells. So there's 3 main systems here for radiation. You have external radiation, which is you have a machine that directs high energy rays into the tumor using a photon machine. Basically just blasts it, and then the whole point of that is to be able to eliminate the tumor. It's done during outpatient visits to a hospital or treatment centers, and it's usually given over many weeks, and sometimes will be given twice a day for several weeks. Okay. A person receiving external radiation does not become radioactive, so that person does not have to follow any kind of special safety precautions. Then there's internal radiation. So this is also known as brachytherapy, and this is a radioactive source is put inside the body or near the tumor, and it can be placed there for any kind of period of time, and it is placed near that tumor, and the goal of that is to destroy the tumor. However, if this internal radiation device is left inside the body for too long, eventually it does no longer become radioactive. And you have systemic radiation, which are radioactive drugs given by mouth or put into a vein that are used to treat certain types of cancer, and these drugs then travel throughout the body. And there are some special precautions you have to take when you're taking these. And so the type of radiation that you get all depends on the type of cancer you have and where it is, and usually that's up to a radiologist or your other doctors to decide what course of treatment is best for you. So, of course, nerve cells can also be affected, but most recover. Radiation therapy is able to target a single local part of the body, whereas chemotherapy and other drugs that you take affect the whole body. But the point of radiation therapy is it's local, so you're able to target a single part of the body, which is in turn going to damage less healthy cells. Okay, and that's of course the goal. So there's also preoperative therapy that can also be used, and that means that before surgery, let's say on a brain tumor, they can use radiation to possibly shrink the tumor to make it operable, so that way a brain surgeon can open you up and then actually remove the tumor successfully. Alright, and so a lot of times radiation, chemotherapy, and other drugs are all used together to combat the cancer cells. It's all a team effort. However, of course, this can result in worse side effects. And stopping cancer from coming back is a very important step in the treatment, because a lot of times just beating the cancer does not actually win the war. Sometimes it does come back, and sometimes it spreads to other parts of your body, and when a cancer spreads to other parts of the body, your survival rate significantly decreases. So it's important that a lot of times they do radiation in the surrounding areas as well, so that way they can reduce that risk of any kind of cancer coming back or spreading. So, the physics behind radiation. Of course, like I said, we know mitosis in the cell cycle is what divides one cell into two cells, right? Cancer cells tend to divide quickly and grow out of control. The radium kills cancer cells that are dividing, but also affects normal cells. So it is used with a photon radiation, otherwise known as an X-ray. Okay, radiation from sources of cobalt, cesium, or a machine called a linear accelerator. This is where it comes from. The photon beams of energy affect the cancer cells by going through the body, attacking the cancer cells during mitosis, and then exit the body. Okay, and the whole point of that is to be able to kill the cancer cells while they're in mitosis. That way you can stop them from multiplying. All right, and as you see on the right, here's a picture of the radiation there, and then the photon radiation. Okay, they're able to target that specific tumor rather than the whole entire brain. So the dosage is measured in grays. Okay, radiation doses are usually divided into 2 daily treatments for several weeks at a time. Doses can range from 60 to 80 grays. All right. So, strontium-89 used for tumors is can be spread to bones. Okay, And there's a lot of different treatment types that can be used for different types of cancers. Amifostine is used to protect normal cells to decrease that risk of having side effects, because the whole point is that you want to kill all the cancer cells and affect the least amount of normal cells as possible. So, the impact on our lives. The yearly medical costs for cancer in the U.S. average about $80.2 billion. All right, a majority from outpatient care. 609,690 Americans die on average every year from cancer. That's about 1,670 people a day. All right, so it is the second leading cause of death, right behind heart disease. All right, now as you see on the right, the cancer death rate has significantly dropped ever since the stereostatic radiotherapy was developed in 1991. But and of course we're still making a lot of strides in cancer treatment, and that cancer death rate is still going to fall. However, if you notice that total cancer deaths actually have gone up, partly due to just our lifestyle habits and all that, and actually the two leading causes of cancer are both preventable, which is smoking and obesity. So, research and funding has drastically improved the lives of those affected by cancer. Alright, and more precision cancer treatment has helped decrease side effects from radiation. So every day that we do this, and we keep working on cancer, and we keep developing these techniques, we're going to be able to save more lives. And some new studies are showing prominent research for mRNA drugs to treat cancer, with far less side effects. And of course, mRNA uses proteins to then attack the cancer cells. Right? Like I said, every year more and more people are saved by these groundbreaking scientific researches. And that is it. Thank you very much.